am going to do a test for a high ankle sprain or syndesmosis. So checking the instability at the ankle. I would do the uninvolved side first to check for the laxity of the ankle. So the first test that I'm going to do is called the cotton test or the clunk test. I am going to stabilize the distal tib fib, and then I'm going to take the heel of my hand and put it against the calcaneus and the talus, and I'm going to provide a lateral glide. And a positive test would be a clunk or an increase in laxity greater than 3 to 5 millimeters compared to the other side, and then reproduction of pain. Another test that I can do is a medial glide, which is the medial subtalar glide, which again, I'm going to stabilize the distal tib fib. Using the palm of my hand, the heel of my hand, I am going to stabilize the push against the calcaneus and subtalar, calcaneus and the talus, and then provide a medial glide. Positive test would be the same as the clunk test, so reproduction of pain, a clunk, or increased translation. Alrighty, so the next test that I'm going to do that also tests for high ankle sprain or syndesmosis is called the Kliger's test. I'm going to stabilize the distal tibia, and then I'm going to take my other hand and I'm going to grab the calcaneus, and I'm going to provide an external rotation force on that ankle, and a positive test would be a reproduction of the patient's pain. Alrighty, so another test to test for a high ankle sprain is the fibular translation test. You are going to stabilize the distal foot. You're going to take the heel of your hand and you're going to go just proximal to the lateral malleolus, and you're going to provide, making sure you're at the same level, provide a force pushing back with the heel of your hand. Positive would be a reproduction of the patient's pain. You can also do this test in two other different ways. You can take your fingertips and kind of grab the fibula and pull it towards you. Or if the patient's bigger, you can go onto the other side using the heel of your hand and push forward. So another test for a high ankle sprain is called the squeeze test. You're going to go to the distal 1/3 of the tibia and fibula, and you're going to provide a compression force squeezing the leg. A positive for this test would be a reproduction of the patient's pain. So another test to determine if a patient has a high ankle sprain would be to have them lay prone. You're going to take your hand in a fist, and you're going to grab the distal leg, and then you're going to provide a solid thump to the calcaneus, and that will be positive if it reproduces the patient's pain. So a test for a lateral ankle sprain, so implicating like the lateral collaterals, is the anterior drawer test. It is going to implicate the ATFL specifically. You want the patient to be relaxed with the foot in slight 20 degrees of plantar flexion. You're going to stabilize the distal tib fib, and then you're going to take the heel into your hand, and you're going to pull towards you anteriorly. And a positive for the anterior drawer test would be a clunk or an increase in laxity compared to the uninvolved side. So another test to test for the lateral collateral instability is the Taylor tilt test. You are going to go just inferior to the lateral malleolus, and with both of your thumbs, you're going to put the patient, just start over because I didn't even say anything. All right, so another test for the lateral collateral instability or lateral ankle sprain is the Taylor tilt test. You're going to have your patient side lying with knees slightly bent. You're going to go just inferior with both of your thumbs to the lateral malleolus. So you're pushing against the talus, and you're going to apply slight inversion force. And a positive test for this would be excessive gapping compared to the other uninvolved side, or a clunk, or reproduction of the patient's pain. Alrighty, so a vascular test to test if a patient possibly has a DVT would be the Homan sign. What you're going to do is you're going to provide a squeeze to the calf, and that would be positive if it reproduces the patient's calf pain. To sensitize this test, you're going to passively dorsiflex the foot and then also provide that squeeze, and again, reproduction of the patient's calf pain. This test has a very low sensitivity, so you would want to follow this test up with the Wells criteria for a DVT. Another vascular test for vascular insufficiency is the Berger's test. You want to have your patient lay supine. You're going to elevate their leg 45 degrees. You want to hold this for 3 minutes. While you're holding, you want to look for the veins to collapse and the loss of color. And after the 3 minutes, you're going to take the patient's leg, you're going to put it into a dependent position, and you want to let it hang for at least a minute. You're looking for the color to return. It's positive if the color does not return within 30 seconds. A test to check for a rupture in the Achilles tendon is the Thompson test. This test, you are going to have the patient prone. You are going to squeeze the calf, and you want to see a slight plantar flexion of the foot. That would indicate a negative test. It would be positive if you did not see the plantar flexion at all. This test has a very low sensitivity because even with a partial rupture, you still have some parts that are still connected, so you will still get that plantar flexion movement. Another test for the Achilles tendon to check if there is a rupture is the Matlis test. What you're going to have the patient do is lay prone. You're going to have the patient bend at the knee to about 90 degrees. Go ahead and bend your knee to 90 degrees. And what you're looking for is a drop of the ankle angle to either dorsiflexion or neutral. That would be considered positive. In this case, the patient is still plantar flexed, so this test would be negative. So a test to test for Achilles tendinopathy is called the Royal London Hospital test, and this is where you're going to go along the Achilles tendon and provide a squeeze until the patient lets you know that they have pain.
Ow.
So I know the pain's right here, so I'm going to gently release that squeeze, keeping my fingers held there for placement. I'm going to ask my patient, can you bring your toes and try to bring them towards your head as far as you can go? And then I'm going to provide that squeeze again. Can you tell me, patient, what does that do for your pain?
It feels a little bit better, not as painful.
So that would be positive. So that would be a positive for the Achilles tendinopathy, and it would be negative if it did not make the pain better. So for the two neurological tests for the foot and ankle, the first test is the Tinel's sign. This test, you're going to be tapping on the front of the ankle, and a positive for this would be numbness and tingling. And the front of the ankle is implicating the anterior branch of the deep fibular nerve. And then the other spot to check would be just posterior to the medial malleolus. You're tapping again. Reproduction of the patient's numbness and tingling. This side would implicate the posterior branch of the tibial nerve. And that's Tinel's sign. So for the other test, which is your Morton's test, this is for a Morton's neuroma. You're going to get metatarsal type pain, usually between the second and third, or third and fourth. And what you're going to do is you're going to squeeze the metatarsals, and a positive for this would be numbness and tingling. Another special test is the functional hallux limitus test. You want to first put the patient into subtalar neutral. So we're going to go ahead. Alrighty. And then now what I'm going to do is passively put the great toe into extension. And what I'm watching is for that first ray. A positive for this test would be for the first ray to go into excessive plantar flexion in order for the great toe to gain extension. So the next special test I'm going to do is called the Feast line, however you want to pronounce it. And we are checking for the alignment of this foot. And you have 3 landmarks. Your first one will be the medial malleolus right here. And then you want the plantar aspect of the first MTP joint. And then you're creating a line here. Then you're looking for the third spot, which is navicular. So along the medial malleolus and the plantar aspect of the MTP joint, your navicular should either fall right on it or just below that line. If it falls excessively below the line, you are positive for excessive pronation or flat foot. Alrighty, for our last special test for the foot and ankle, we have the windlass test. And for this test, you want them to be weight bearing, standing on a box, standing on a stool. You want their toes to be hanging off, and this is looking for like a plantar fasciitis type pain. So what you're going to do is you're going to passively extend the great toe. And a positive test for this would be if the patient, if it reproduces the patient's plantar heel pain. So a test for the Achilles tendinopathy is called the 20 degrees of plantar flexion. Taking the palm, taking the heel in your foot. So with this test, you are going to go just inferior to, yes, inferior. Just start over. So another test for a high ankle sprain, it's called the squeeze test. You're going to take you're going to go to the proximal,